from MTN, the Montana Television Network. This is Face the State.
Good morning and welcome to another edition of Face the State on the Montana Television Network. I'm Mike Dennison, MTN's chief political reporter. As you know, the 2019 legislature is underway in Helena, and today we'll be talking about one of the biggest issues confronting the session, whether to extend Montana's $550 million a year Medicaid expansion program. Medicaid expansion began in 2015 and now provides government-funded health coverage to 95,000 low-income Montana adults. The federal government covers about 90% of the cost, but the state must pay the remainder. When lawmakers approved Medicaid expansion in 2015, they put an expiration date on that program. That date is June 30th of this year, and the legislature will vote whether to continue Medicaid expansion as is, make some changes, or end it altogether. To examine the issue today, I'm joined by two lawmakers who have been and will be right in the thick of the discussion on Medicaid expansion. Democratic Representative Mary Cafaro of Helena plans to sponsor a bill to extend the program in its current form. And Republican Representative Ed Buttrey of Great Falls, who sponsored the bill in 2015 that began Medicaid expansion, plans to introduce a bill this session to extend and modify the program. Both of you, welcome to the show and thank you for coming. Let's start with you, Representative Cafaro. You want to extend the program in its current form. Tell us a little bit about what Medicaid expansion is, what it does, and why it's good for the state to continue it.
First off, before I get started, I want to thank Representative Buttrey for sponsoring Medicaid expansion in 2015. I co-sponsored the bill. And he is the reason that we are here today in such a great state. So number one, Medicaid expansion is not a typical welfare program. It's a program that provides health insurance for mainly people who are working. For example, 8 out of 10 people who have Medicaid come from a family where a member is working, 7 out of 10 are working themselves. And so Medicaid expansion is really health insurance for people who work, but either their employer doesn't provide health insurance or they don't earn enough to buy it on the market. And it is modeled after a private health insurance product. So it's a health insurance product like everyone has. For example, there are cost sharing, there's premium and co-pays for Medicaid members. And to date, $10 million have been collected in, have been paid in premiums and co-pays by people who have Medicaid expansion. Mm-hmm. Number two, it has all of the similar structure of a health insurance product, like utilization review, prior authorization, caps on services, and it keeps people working. It's really a good work support, and it's good for the economy.
And it's also supported by taxpayer money, of course, from federal and state. And Representative Buttrey, of course, you're a Republican who supported Medicaid expansion 4 years ago, and I'm assuming you'd like to extend it, but you think the program may need some changes. Why the need for the adjustment?
Thanks, Mike. It's a good question. The program has been incredibly successful for the state. We've seen $350 to $400 million of new spending. We've seen a lot of personal income growth. We've seen 5,000 jobs created. We've seen participation in the jobs market by folks that are eligible for the health plan increase between 6 and 9%, which is something never before seen in other states. And the new data that's just coming out now actually reaffirms that that is indeed happening. So there's a lot of good within the program. When we created the program, we created an oversight committee to collect data, to find out how the program was doing, to identify efficiencies, to figure out how we could make the program even better. And then we also had anticipated that there would be changes at the federal level to allow us to ensure that the program moving forward could be more sustainable. We would have additional options for pay-fors. We would be able to put different requirements and reforms into the program as it exists today. And I think it's important that we do those things. The rules have changed to some extent. We've collected data, and now it's time to reform the program.
And we'll go into some of those in more detail later in the show. Now, what's the status of your bill draft? And who's working on it? And do you know at this point some of the things it may contain?
Yeah, so the bill draft is in drafting. We've been having daily meetings. We just finished a meeting this morning to identify and to answer questions that our staffers have on what we intend for the bill to look like when it's drafted. So it's a complex process. There's a lot of sections of law that are affected, including the original HELP Act sections. And I know that we're going to have a lot of comments from people across the full political spectrum. I would imagine in the next week, next few days potentially, that those documents will be more publicly available. And then we have to wait and see what people think about it, what additional ideas come in before we actually drop the bill and introduce it into the legislative process.
Okay. Now, Representative Cafaro, your bill, which also has yet to be completed or introduced, it's just a straight extension of Medicaid expansion? There's no changes in there, or what?
My bill is called Keep Montana Healthy. And the reason it's called Keep Montana Healthy is because that's exactly what Medicaid expansion is doing. It's keeping Montanans healthy. And so we lift the sunset, and in 2015, I not only supported Representative Buttry's Medicaid expansion bill, but I co-sponsored it, as I said. And the reason that I supported a sunset is because it made sense to stop, look at what the data shows, and then move forward accordingly. And so my bill lifts the sunset and continues things as they are. And the reason for that is because the verdict's in. It's firing on all cylinders, doing a great job. It's good for, and actually doing much better than I ever anticipated in so many ways that are unexpected. So like Representative Buttry said, the money into the economy, about $500 million that come back to our state that otherwise wouldn't be in the economy, nearly $300 million in personal income, an increase in workforce participation of 9% for people in that income level, which is not being experienced in other states and is twice that of the other income levels in Montana. But the piece that is different in my bill from what we're doing now is an increase in the investment in workforce development program. It's currently called HelpLink, and I changed the name to Keep Montana Working. And the reason that there's an increase in the investment in the workforce development piece is because it's been so successful currently, so why wouldn't we invest more money in it? Montanans value work. They want to work. We're hard-working folk, all of us, all across the board, and that includes people who have Medicaid expansion.
Now, of course, Republicans control majorities in both houses of the legislature, and we're going to need some Republican votes to get this through. And I think I'm probably accurate in saying that Republicans are pretty much in agreement that the program may need some additional restrictions. So, I mean, isn't that a political reality that you're facing as a Democrat, and yet your bill doesn't have any of that?
So I get elected to represent my constituents. I don't get elected to live in someone else's political reality. So I am here to protect the health care of nearly 100,000 Montanans and not to create eligibility restrictions or to any way go backwards. And what I mean by that is nearly 85,000 Montanans who have Medicaid expansion have accessed preventive services. An oncologist presented at a conference I was at, and you know what he said? He said, I will see these people no matter what. The difference is I can do something about it now. We have really serious health problems in Montana. Medicaid expansion is a solution to many of those problems. Number two, suicide. We have the highest suicide rate in the nation. Our veterans commit suicide at twice the national average. What happened before Medicaid expansion? About 10% of Montanans who had a mental health issue were not able to get in to see somebody. Now, 33,000 Montanans have been able to get the services they need when it makes the most difference. And then last, cancer. As I talked about cancer, so 7,300 women have gotten breast cancer screenings, 102 diagnoses. For colon cancer, 7,000 have had colon cancer screening, 2,500 potential cancers have been averted. And so I live in that reality. That's my reality, the reality where I represent people, and I'm here to try to shape what's in their best interest, not live in someone else's political reality.
Now, Representative Buttry, I'm sure that you would agree that the Medicaid expansion has done a lot of good things. In fact, you said that earlier in the show. But there are going to be some things that Republicans are going to discuss to place on this program. One of them possibly might be some form of work requirements. I've heard that a lot from a lot of GOP people. Is that going to be something in your bill, and is that even legal? Is that something that will be accepted by the federal government and the Trump administration?
That's a great question, Mike. And our bill is actually called the Medicaid Reform and Integrity Act. And so it is heavy on what we call reform and integrity, which means that everyone that participates and benefits from the program has to help the program be successful. Some of the reforms we offer are to enhance the waste, fraud, and abuse system within DPHHS, to look at eligibility requirements, to utilize our taxpayer integrity fee, to make sure that we are looking at assets of participants, to reform programs like telemedicine, but also, just as in Representative Cafero's solution, we are going to beef up the HelpLink program and provide grants to private sector companies that employ out of this population and provide training. But certainly one of the biggest differences between our bills is our community engagement provision, of which work is a part of that. Community engagement is a way for the users of the system to help pay for and participate in the success of the system. It is not meant to be punitive. It's meant to be responsible, something that is obtainable. We've heard the governor and Representative Cafero talk about 70% of the folks on the HELP program are working. Mm-hmm. So, part of the question is, well, if that is the case and work is one of the many ways to meet the community engagement provision, what is it that we're so concerned about? The intent is not to take a drastic number of people off the program. Even more so, it's to identify the initial population we looked at were uninsured, that we wanted to provide insurance for. We have a significant number of other parties that were previously insured and have now come over to the HELP Act program. Mm-hmm. We want to be able to tell that story. Which of those folks did we anticipate that happening? For folks that were previously insured and came over that we weren't expecting, how do we address that? How do we make sure that the legislature understands that we're serving the people that need it the most in a situation where we're limited, where we don't have unlimited funding? And that's something else in our bill is we provide pay-fors to ensure that any increased cost of moving the program forward is more than covered by the participants, including hospitals and insurers, people that benefit from it, and that we put no additional burden on the taxpayers. And in fact, we expect to actually lessen the burden on the taxpayers by continuing the program.
And we'll come back to the money thing later in the show, but when you say community engagement, what does that actually mean in terms of what you're going to require of people who are on Medicaid expansion or covered by the program?
So Mike, it is something that would be measured on a periodic basis, such as monthly, and there would be a certain number of hours of community engagement that would have to be performed. Certainly work hours count towards that. Taking care of children, elderly members counts for that. Volunteering counts for that. Doing a lot of different services that actually benefit the community and the state all cumulatively add up to meeting that community engagement requirement. It's been our goal, and what we're trying to do is utilize existing state systems that can measure each of those provisions so that we don't add a lot of cost to the program or add a lot of employees to have to do this measuring. These are systems that exist within Revenue, Department of Labor, and DPHHS. So again, we want everyone to participate in the success of the program. Hospitals, insurers, patients, members, everyone participates and helps us move the program forward.
Representative Cafero, what are your thoughts on this so-called community engagement requirement? Is that something that you would say no to and think is not a good idea, or would it be something that you think Democrats might consider?
Well, let's talk about who we're talking about.
Okay.
So of the 95 to 100,000 people at a point in time, the study was conducted that we've referenced a number of times, 7 in 10 are already working,
yes,
and 8 in 10 come from working families. So we know that. Let's talk about who is not working and why, the other 30%. And that is people who are caregivers. And so a caregiver, 55-year-old man, his wife has Alzheimer's dementia, stage 4, he's caring for her. That's really important work, and if you don't think it's work, then I'm here to tell you it is, and that's valuable.
Although you heard Representative Butler say that could probably qualify for
absolutely. So that's in Buttrie's world,
mm-hmm,
that it would qualify for an exemption.
Mm-hmm.
Let's talk about the young mother who has single mother who has 3 children and went back to college to try to improve her economic status. That might qualify for an exemption too. What about the person who has a disability and mental illness? That may qualify too. But what we've learned is that In the one state where they do have work requirements, Arkansas, 17,000 people have been removed from the rolls. 17,000. And of those 17,000, the majority of them were either qualified for an exemption or were working. A second point that just came up is one state had their waiver approved and they had caregiving to count as an exemption. The federal government sent it back and said, this is your definition of caregiving. We amend your waiver. And it did not include that 55-year-old man who's saving the state a lot of money by taking care of his wife at home. And so what we know now is that we have HelpLink, and it's successful and it's working, and that most people are working and they live complicated lives. Do we want to, it's like a solution looking for a problem, and every state that's gone down this road or is trying to go down this road is spending a whole bunch of money on IT and building up the bureaucracy to chase around, in our case, 100,000 people for the 3,000 who we don't have information on. Montanans value work.
So, Representative Buttrey, I'm sure you've heard this argument before. The governor himself has made it saying, look, we may be spending a lot of money building up this big monitoring system to just fix a very small problem. Is it really worth the money or the time spent to do that?
I think so, Mike, and part of it is, and I'm glad that Representative Cafaro brought up the people that would have potential issues with community engagement, and we've listened to those comments and we've exempted those parties within what we feel are allowable rules with CMS to make sure that those folks that are taking care of dependent children, elders, that are full-time students in certain cases, or medically frail, disabled, elderly, the list goes on to make sure that those people aren't at risk for losing their health care. I've also heard the governor and members from the other party talk about Arkansas and talk about other states where they've gone with community engagement provisions. You know, I remember the same discussions and arguments in 2015 of people saying, well, these Medicaid expansion has been tried in other states and it's not working. It's too expensive, it doesn't work. We innovated. We do that in Montana. We came up with a solution that was different and is now the model for other states to follow. I believe that we can use that same practice of innovation to come up with a community engagement provision that's responsible, that ensures that everyone has got skin in the game, that they're participating in the program towards its success, and that we can eventually become a model that other folks will follow. Now, we are putting provisions in place, like I stated earlier, that the government can currently track. And if the government wants to say that agencies within government cannot communicate, cannot share data, then that maybe is a bigger issue. They certainly need to be able to do it. There's no reason for all of our agencies to independently operate and to buy the same sets of data. They need to communicate, and that's what we're asking them to do with the MARIA Act.
Let's talk about another thing that Representative Buttrey brought up, and that is the asset test for people on this. Right now, the current law calls it a taxpayer integrity fee. I don't believe it's ever been enforced. Representative Cafaro, right now, the people who are eligible are based solely on income is the eligibility, up to 138% of the federal poverty level, which is about $16,750 a year in income, pretty close to about $8 an hour. So not a lot of money. But if you have land, equipment, real estate, cars, investments, why shouldn't that be taken into account for the eligibility?
So, like I said about the suicide rate, veteran suicide rate is twice that of the national average in Montana. Farmers' suicide rate is higher. I think farmers have they have a lot of assets.
They do.
And they need to see a doctor just as much as anyone else. And then I'll go back to you said the Taxpayer Integrity Act isn't enforced. Actually, it is enforced, and it costs a lot of money. And you know how many people they've tracked? 3 people.
I was going to say 1, but 3, okay.
Yeah, so
not many.
So there you go. You're chasing 100,000 people to find 3 people. And so the asset test will just be decided federally by CMS. It's not anything that we can do here. Currently, they don't allow it. I'm not sure if other states have included it in their waiver. I haven't found one that has, but maybe. So that's a decision, not a state decision. It's not allowed by CMS at this time.
Representative Buttrey, of course you mentioned it. Is that going to be part of your bill, and what will it look like, and why should it be in there?
Thanks, Mike. So yes, the taxpayer integrity fee, as we implemented it, really didn't work out that well. It did not allow a lot of looking at participants and members of the plan. So as part of our reforms, we have rewritten the TIF section, which is put out or utilized by the Department of Revenue, to make sure that we are looking at assets that people have. We are not allowed through the federal system to exempt people from care or from the program based on their assets, but what we did is come up with a way to measure assets to make sure that if folks had significant numbers of assets or dollar value of assets, that they were paying more towards the cost of the program.
Right.
I think we've made the fixes that will allow government to use it, to allow all members to be looked at, to make sure that we have limited resources, we have folks that we need to prioritize providing care for, that we are putting the resources to the best use, and because this is taxpayer money after all. And I honestly believe if someone has significant assets, even if they're at a point in time where their income may be a bit lower, that they need to make some decisions and participate a little bit more in sharing the cost of the program.
And Representative Cafaro, are you opposed to that, as Representative Buttrey has spelled it out, just the principle of telling people, okay, if you have a lot of assets, maybe we should have something that says, okay, you're going to have to contribute a little bit more than the person who doesn't?
I haven't seen the language, and so I can't comment until I see the language.
Okay, fair enough. Another thing I wanted to ask about, and that is drug testing. I'm not sure if that's going to be part of your proposal or not, Representative Buttrey. Is it? I mean, possibly. And the way I've heard it described by Republicans who favor this is that we're not doing this to be punitive. We're doing this because this is a healthcare problem and a program. And if someone has a drug problem, we should know about it and perhaps get them into treatment. Representative Cafaro, what do you think about that?
Well, what we know is since Medicaid expansion went into effect, I have here that prior to Medicaid expansion, 90% of people who were addicted or alcoholics were not able to access treatment. At this time, 10,000 people, that's 10%, have accessed treatment. And not only treatment, but the follow-up care that they need.
So it's happening, you're saying? It's
happening without spending a lot of money and having a, that's an eligibility restriction. If people need treatment, then you create the environment and they're going to go. Not cut them off before they even get to that point. And the states that have had drug testing have like I think it's 0.03% of people that actually test positive. Where is the money going to come from for that? And wouldn't it be better served investing in people receiving treatment? I mean, seriously, drug testing is not free.
No, it's not. Representative Buttrey, tell us about if we have drug testing in there, what would it look like and what would be its intent?
So thanks, Mike, and I agree, Representative Cafaro and I agree that some of the biggest successes that we can have and have had are by taking an addicted party, getting them unaddicted, getting them into the workforce, and providing for themselves, the family, and their family. So this is an absolute critical part of the program. I am not a fan of drug testing to kick people out of the program, because you simply then take away their ability to get clean, you get them back into the emergency rooms, they get back into chronic physical and mental health conditions, so that's not the way to do it. What we want to do, though, is we want all parties on the program to participate in a health assessment as well as a job skills assessment. Part of the health assessment will allow the department and/or providers to determine if someone potentially looks like they could have addiction issues, and if so, to offer to them, to prescribe to them treatment so that ultimately they can get healthier, they can get unaddicted, and they can do better for themselves and their families. So we want to identify those folks that we can provide those services for. Certainly we don't want to throw them off of the program because they can be some of our greatest successes.
And it sounds like there's a pretty strong support for that within your caucus. Am I correct in saying that?
There's a strong support for drug testing. It's what happens after the drug test. I think we've been relatively successful in explaining to people that if it's used to throw people off of the program, then that just becomes a larger burden for the state and for families, and it's really not what we intended to do with the HELP Act. But if we can identify them through a health assessment, not through a drug test, but health assessments are used in other states and they've been successful in identifying people that need treatment help.
We've got about 4 minutes left in the program. I want to talk a little bit about the money. Representative Buttrey, it's probably going to cost anywhere from $30 million to $60 million for the state to pay for this going ahead. Is that just coming out of the budget, or are we identifying a revenue stream that you have in mind that's going to pay for this? Contributions from hospitals, premiums, premium taxes, whatever. Where's the money coming from?
So in the Reform and Integrity Act, we provide pay-fors. What we do is we cap the statutory appropriation that's currently providing monies into the system so that it can't grow at any more than medical inflation. And then we have the parties that benefit from the program, the providers, the insurers, pay into the program in such a way that it isn't cost shifted to the users of the program. We went to those parties and said, tell us how you'd like to pay versus us deciding how they should pay. And they've come back with proposals that have fully funded not only the program moving forward for any increased cost, but also the HelpLink program to create the grants. And we feel like we will actually reduce the general fund and taxpayer burden to continue the program.
Representative Cafaro, where do you think the money should come from, or do we need some extra money to pay for it, or what is the fiscal situation from your view?
Well, we can't, Medicaid expansion pays for itself. We can't afford not to do it. And it is in the governor's budget. And one piece of my bill that I forgot that is also in Representative Buttry's bill is the hospitals offered the same pay for to me as they did to Representative Buttry. Having said that, I don't think it totally makes sense to tax the industry that keeps people healthy and let the industry that creates so much harm to people's health and so much expense to our state
Tobacco.
To skate. Yeah.
Yes. Speaking of which, one thing we haven't talked about yet, and that is the Initiative 185, which was on the ballot last year, as you well know, that asked voters to approve the extension of Medicaid, passed this year, and to impose tobacco tax to help pay for it. Of course, that went down to defeat. Given that result, are we listening to voters by saying, okay, we're going to extend the program? What do you think, Representative Buttry?
Well, I think I-185 was a broken promise between the legislature and executive. That when we put the sunset on, we agreed in 2015 that we would come together to come up with a compromise solution to bring the program forward. I-185 being introduced said to the legislature, we don't need you, we're going to do it on our own. Obviously the taxpayers spoke up and they said, hey, we don't want to tax this one entity to pay for health care or whatever reason they had to vote against it, which now puts it in our hands. I am not a believer that we should go outside with the governor's proposed tax increases to pay for health care. I think that going into other parties that don't have anything to do with health care to fund a program, it doesn't make any sense. We need to work within the folks that benefit from the program, get the pay-fors from there, reduce the burden on the taxpayers. And when we do this, and we've seen the positive benefits of the program, it just makes sense to continue with the program moving forward.
Representative Cafaro, what is your take on whether your approach or whoever's approach is responding to the vote on I-185? And I assume that you've sponsored tobacco tax increases in the past. I don't think it's going to fly now. What's your view on just how the voters were talking when they said no to that?
Well, it wasn't a no to Medicaid expansion. That's what we know for sure. And that's why I'm working with Representative Buttry, or I hope to work with Representative Buttry and other legislators to roll up our sleeves and come up with a solution that protects the health of 100,000 Montanans.
Okay. We're just about at the end of our show right now. I'd like to thank both of our guests today for coming here and talk about Medicaid expansion, one of the biggest issues before the session. Representative Ed Buttry, Republican, Great Falls, and Representative Mary Cafaro, Democrat from Helena. The legislature will continue through the end of April, close to probably the beginning of May. I'm going to be back in March to talk about perhaps this issue and some other issues still coming before the session, to take another closer look at what's happening in Helena. Until then, I'm Mike Dennison. Thanks for joining us.
You've been watching Face the State, a presentation of MTN, the Montana Television Network.